generate hypotheses for testing in these pilot studies. We found that communication with a physician was a big concern. They only told me, "You have cancer, and it is invasive, so we have to remove your breast." It was something that they didn't think about how to tell me in a sensitive way. They just told me in a very crude way. Another woman said, "I would have liked for them to give me more information about the cancer because they never gave me specific information, what type of cancer I had or how advanced it was." From that, we came up with the study design to look at communication with physicians. So we identified a cohort of physicians. We did a baseline survey with them on communication skills and practices. Then we randomly allocated them to two groups, one group that received an intervention, academic detailing, so it's like one-on-one continuing medical education, and the other group didn't receive any intervention. We included a lot of the kinds of activities that the previous speaker mentioned, some role-playing, interactive activities, and so forth. And we ended up with measuring their ability to communicate with their patients. So that's an example of how you can use qualitative research to design studies. The last thing I want to talk about is treatment. The concerns here were many. Well, at the beginning, they told me I had 3 years to live. Another one said, "I would have liked more information about chemotherapy because everything was so rushed. Only the nurse talked to us. The doctors were too busy." Another person said the doctor, never told me I could get a second opinion. I wanted my whole breast removed, but he would only do a part. So again, you see that there are lots of confusions about what breast cancer treatment involves. From this, we designed a patient navigation program. That is, it appeared to us as though it would be very beneficial for women to know a lot more about treatment than they already knew. So what we did in a Latina population, they're very responsive to promotores, who are lay health workers. So we trained promotores to provide information to women with breast cancer. The promotora calls within 24 hours of a diagnosis of breast cancer. She communicates, it's almost always a she, communicates with the patient, and the communication is vital. We teach many skills and have them practice the skills in role plays before they go into the field. The promotora assesses the patient needs and answer questions and may even accompany the patient to the physician. And the promotora provides ongoing tracking and monitoring of whether or not the patient is receiving her treatment. So what I wanted to conclude with is that qualitative research does a lot, and it does a whole lot more. It helps us to better understand an issue. We can comprehend the views of a population. We can identify barriers and facilitators for intervention. And importantly, it also contributes a great deal to a needs assessment or a situation analysis, as Ben was talking about earlier this morning. So in conclusion, qualitative research is a valuable part of the scientific inquiry. It leads to hypotheses, study designs, and programs. And more importantly, and most importantly, qualitative research goes to where the people are. The issues that are salient for the people, whether they be women with breast cancer, whether they be decision makers, ministers of health, they have much meaning for the researcher. So thank you very much.
So if all of the morning speakers